That's right, Molly. There's at least some more good news today where hospitalizations do remain high, at least for today. They are remaining steady.
Our hospitals are very full. The healthcare workers are very tired.
It's a warning from Washington's top health officer about the number of COVID-19 hospitalizations across our state.
It's high and it's going up, and that's a little bit concerning, but it doesn't seem to be going up as quickly.
Hospitalized COVID-19 cases doubled in November, but over the last week to 10 days, data shows there's been somewhat of a plateau. Dr. Chris Dale, Chief Quality Officer at Swedish.
We had a bit of a surge over the last couple of weeks, but that seems to have abated over the last several days, and we're holding steady.
Right now, between 80 and 90 COVID patients are being cared for at Swedish's facilities. That's a drop from just 2 weeks ago.
It looks like we've been able to bend that curve yet again.
But Dr. Laffey says there's still tremendous disease activity across the state, even more than during the spring surge. Right now, there are 1,177 COVID patients hospitalized across Washington.
What's concerning to me about our current situation is that the entire state is being hit really hard at the same time.
Data shows ICUs are nearing capacity in every corner of the state.
If a hospital system in a given region becomes kind of overwhelmed, there's generally not other hospitals or regions where we can move patients around to.
Doctors say the first vaccine approval means this is now the beginning of the end, but it's critical to remain vigilant.
We just need to hang in there for a few more months.
We're expecting another rush on COVID-19 testing with Christmas just a couple of weeks away. All of us are being urged not to travel or gather this holiday season, but as KOMO's Steve McCarron reports, doctors know that not everyone will follow the state's guidelines.
Is Christmas and New Year's a big concern for you, and why?
It definitely is.
Dr. Mark Del Beccaro is already starting to see the impact of the Thanksgiving holiday on COVID-19 case and death counts nationwide. He fears another jump is coming in the weeks ahead, even as more testing sites open across the region, including this one in Enumclaw today and another one in Lakewood.
Our concern is a lot of people do get the test, and they think that means that they're okay.
Right now, restrictions on indoor gatherings are still in place across the state, but there are exceptions for those who quarantine for 14 days ahead of time or quarantine for a week prior and get a negative COVID-19 test no more than 48 hours before an indoor gathering. Today, the governor's office told me testing and quarantine makes the chance of unknowingly spreading the virus lower, but it still does not guarantee you won't spread the virus.
Testing only tells you that you're negative from an exposure that was anywhere from 3 to 10 days before that test.
Del Beccaro points out most holiday gatherings tend to take place indoors where there's less airflow. With vaccines still weeks and months away for the vast majority of the population, doctors say it is best to sit those gatherings out until next year.
The message should be clear. We've seen a rise in Thanksgiving when it is confirmed, and then we need to be extra vigilant with Christmas, Hanukkah, and New Year Eve and make sure that we don't spread COVID-19.
King County will open another new testing site at Bellevue College. That will happen next Tuesday for hours. Just look for this story right now on KOMOnews.com. Steve McCarron, KOMO News.
There's a big push now to get people all over the United States vaccinated safely and securely to stop the spread of COVID-19.
Right now, there's an effort to get thousands of dentists and optometrists the green light to help administer those shots. KOMO's Suzanne Fon explains.
We really need to have sort of an all-hands-on-deck approach to administering the vaccines.
With hundreds of millions of people now needing to be vaccinated for COVID-19 in the U.S., medical experts say more needs to be done to make that possible. That includes letting dentists and eye doctors legally help. Gary Kyoto is the dean of the University of Washington Dental School.
I think everyone knows that dentists give a lot of injections all day, every day. And the injections that we give are far more technically complex.
Right now, there are nearly 5,200 active dentists in Washington state. They all have the training to give injections.
And dentists are trained to give injections of other medications in the arm, to do intravenous blood draws or administration of medication for sedation, for emergency reasons. So we certainly, it's well within the scope of our training.
Supporters say dentists offer tremendous people power.
If we have dentists there who can do this. That's going to be critically important for those underserved areas.
In Washington state, there are also nearly 2,000 optometrists. Dr. David Stanfield is president-elect of the Optometric Physicians of Washington.
All healthcare professions need to move towards doing what role we can play in order to reduce the waiting lines for getting vaccine. And optometric physicians are wanting to do their part in order to help vaccinate our citizens in Washington against COVID-19. The more professionals that can be involved in the vaccination process, the better.
In Seattle, Suzanne Fawn, KOMO News.
Hi, everyone. I'm Preston Phillips from KOMO News. Thanks for checking out the KOMO YouTube channel. You can see more of our videos right here by clicking on the video links for more news from the Seattle area and Western Washington. Oh, and don't forget to click the subscribe button below so you don't miss our YouTube updates.